I get this text, is this real? Breakthrough anti-aging cell discovery could help you stay younger for longer. We can program specific immune cells, specifically T cells, to recognize and kill cancer cells. In addition, most aged mice showed improvements in their exercise capacity at 2.5 months after treatment compared to pre-treatment levels. For the running duration, it does seem to be the case that there is a statistically significant increase in the mice that got the CAR T therapy. My name is Matt Kaeberlein, and welcome to the Optispan YouTube channel. Hey everyone, welcome to the Optispan podcast. This is Longevity This Week, episode 2. So this week I'm flying solo. My colleague Nick is out on paternity leave, so huge congratulations to Nick and his family, and we are all super excited to welcome the first Opti baby, Adeline Arapis. So one of the things I want to accomplish with this format is to cover some papers that garner attention in the popular media and hopefully help you think about what they really mean. I'll take you through how I evaluate the importance of new studies and also try to fit them into the broader context of state of knowledge in the field. And I'll be honest, sometimes it's a real struggle for me not to become too cynical about the longevity field, in part because of how new results are often presented in the media. And, more disappointingly to me, often how they're presented or mispresented by the scientists themselves, who, at least in my opinion, really ought to know better. So many of the articles that I cover here will unfortunately fail to live up to the hype that they generate. And I apologize in advance if I come off as overly negative. As many of you know, I'm actually quite optimistic about the future of this field. And I'll do my best to present things in an unbiased and impartial way. But it's really my hope that this kind of rigorous evaluation will help people separate the real science from the science fiction and maybe provide some much needed credibility. So the paper that I'm going to cover today is titled Prophylactic and Long-Lasting Efficacy of Senolytic CAR T Cells Against Age-Related Metabolic Dysfunction. And it was recently published in the journal Nature Aging. And so this paper is actually a follow-up to a paper published by the same group about 3 years ago that was published in Nature titled Senolytic CAR T Cells Reverse Senescence-Associated Pathologies. And maybe it's just worth stating explicitly, many of you probably aren't sort of familiar with the hierarchy of scientific journals. Nature is one of the top 2 or 3 general scientific journals in the world. I think most people would say Nature and Science really are at sort of the top of the hierarchy if you could pick any journal to have your paper published in. Nature Aging is one of many Nature family journals, but just not to be confused with Nature. So sometimes in articles, you'll see things like paper published in Nature, when in reality it was published in one of the 2nd or 3rd or 4th tier Nature family journals. So just one way to think of it is Nature Aging, not nearly as high profile as a publication in Nature. So the first paper from this group, again, back in 2020, was published in Nature. This is a follow-up to that paper published in the Nature family journal, Nature Aging, which is more of a field-specific journal. And the reason this paper actually first came across my radar was based on an article that was published in the BBC Science Focus, actually first sent to me by a friend of mine. And I get this text, is this real? ? And it's got this picture of what on my phone actually I thought looked like some sort of sea creature, but is in reality supposed to be a human immune cell. And the title of this article was Breakthrough Anti-Aging Cell Discovery Could Help You Stay Younger for Longer. And then the subtitle is A White Blood Cell in Our Bodies Could Give Extended Youth. Okay, so that's the article, and it's referring to this Nature Aging scientific publication. And so what I want to do today is take you through the Nature Aging paper, and then we'll come back and look at the BBC article and see, how well did that actually represent the study. So I think the first thing to appreciate, the title of the paper again is prophylactic and long-lasting efficacy of senolytic CAR T cells against age-related metabolic dysfunction. The first thing that I would suggest is the title should have actually really had 2 additional words, in mice. So all of the experiments presented in this paper were done in mice and in a specific what's called inbred mouse strain, C57 Black 6N. So there are some people who believe that C57 Black 6 mice are really not a very good model for studying anything in biology. I don't fall quite in that camp, but I do think it's important to appreciate that studies done in C57 Black 6 mice are done in a very specific inbred mouse strain. There are concerns about using inbred mouse strains. And then, of course, mice aren't people. So we just have to recognize that the things that are discovered in mice may or may not actually translate to humans. So I think the first thing that I like to do is I look at the title of the paper and I read the abstract, and then I go through the paper and ask, did they actually demonstrate what they claim in the title and the abstract? So I'm going to start by kind of taking you through the abstract of the paper. And the abstract starts with the sentence, senescent cells, which accumulate in organisms over time, contribute to age-related tissue decline. So that's true. Just to give everybody a little bit of background, senescent cells are one of the 12 what people call hallmarks of aging. Again, there will be an entire episode on the podcast devoted to the hallmarks of aging. I think all you really need to appreciate today is that senescent cells are one of 12 hallmarks of aging. So they're a part of the biological aging process, certainly not all of the biological aging process. And you may have heard of senescent cells referred to as zombie cells. So the idea here is that with age, our bodies accumulate cells that stop doing their jobs, right? So every cell in your body has a job to do, much like in the human world. Sometimes people stop doing their jobs. Sometimes cells in our body stop doing their jobs. Many times, cells that stop doing their jobs will die. They'll undergo a process called apoptosis. Sometimes, cells that stop doing their jobs will start dividing uncontrollably. They become cancers. And then senescent cells are sort of a third variation of cells that stop doing their jobs. They just kind of hang out, which really wouldn't be that much of a problem. They don't divide, but they start giving off its signals that can then cause dysfunction in tissues and organs. And these are not exclusively, but by and large, chronic inflammatory signals. Okay, so senescent cells accumulate with age. They are thought to contribute to some of the functional declines and diseases that go along with aging. And again, sometimes you'll see these referred to in the popular media as zombie cells. Okay, so that's the background on senescent cells. The next sentence in the abstract reads, genetic ablation of senescent cells can ameliorate various age-related pathologies, including metabolic dysfunction and decreased physical fitness. That is based on previous work in the literature. While small molecule drugs that eliminate senescent cells, those are called senolytics, partially replicate these phenotypes, they require continuous administration. So this is referring now to a large body of literature on senescent cells. And the first studies are talking about what we would refer to as genetic removal of senescent cells. And the first example of this in the context of normative aging is a 2016 Nature Aging paper from Darren Baker and Jan van Dersen, where they basically just engineered cells that are expressing a marker of senescence, in this case P16, to kill themselves when exposed to a chemical stimulus. So the details here don't really matter, but just think about it this way. Our bodies are accumulating senescent cells. The mice that are aging in the laboratory are accumulating senescent cells. Darren and Jan and their team created a trick where you could feed them a specific chemical, and when you fed them the chemical, it would cause those senescent cells expressing P16 in this case to die. And what they saw was that they could increase lifespan when they did that. And then in a whole bunch of other studies, like really dozens of studies in the literature have gone on to show that not only can you increase lifespan when you genetically clear senescent cells, but you can improve a whole bunch of markers of biological aging. So functional declines, organ and tissue function. So I think there's a pretty clear case that if you genetically clear senescent cells, you can have some improvements. You know, I often will note this, and I think it's worth noting, the benefits that you see or that have been achieved so far with genetic clearance of senescent cells or with pharmacological clearance of senescent cells have yet to match the size of the benefits we see from something like rapamycin. So rapamycin is more effective than senolytics, at least so far, and come nowhere near the magnitude of benefits that are well established over decades of literature for caloric restriction in mice. So senolytics, clearance of senescent cells, is sort of a second tier health span or longevity intervention in my view, in terms of magnitude of effect. Okay, so there is this large literature, though, previously genetically clearing senescent cells or with small molecules. That's what people call senolytics, are drugs that can kill some senescent cells. Okay, so now we'll move on in the abstract. The next sentence is, we have developed a senolytic therapy based on chimeric antigen receptor, or CAR, T cells, targeting the senescence-associated protein urokinase plasminogen activator receptor, or UPAR. And we previously showed these can safely eliminate senescent cells in young animals. Okay, you're probably like, that was a really, really big sentence. Yes, so let's go through what they're actually saying here. So first of all, let's start with CAR T therapy. Okay, so CAR T therapy really comes from the cancer immunotherapy world, and it is a technology that has been developed whereby we can program specific immune cells, specifically T cells, to recognize and kill cancer cells. And we do that by giving them a target that hopefully, at least, only the cancer cells express on their surface, right? So here's one way to think about this. This is maybe a useful analogy. If you think of cancer like some bad guys, right, who take a bunch of civilians hostage in a town square, and the bad guys all have to wear red baseball caps, right? So there's some, exterior feature where we can tell the bad guys from the civilians. None of the hostages have red hats on. So the CAR T cells are sort of like snipers on surrounding buildings who can selectively remove the bad guys without harming any of the civilians. And so in the same way, the CAR T cells remove the cancer cells because they have an exterior signal that the CAR T cells recognize and then target those cells for removal. Okay, so that's how CAR T therapy clears cancer. This has sort of the added nuance, though, that because we have primed the immune system with the CAR T cells, they stick around. And so it's like if the snipers kind of stayed on top of the buildings even after the crisis was resolved, in case any of the snipers came back. So the immune system can continue to sense cells that display this surface marker that is a cancer marker. And that's really the basis for cancer immunotherapy. So we can design these things to target a specific cancer and cause the person's own immune system to do the work of clearing the cancer cells. Okay, so now the tweak here, and this is from the paper that was published about 3 years ago by the same group, is harnessing the same technology to allow the immune system to target aging, right? And to specifically target senescent cells. So the idea would be, instead of programming the T cells to clear cancer cells, you program them to clear senescent cells. And you do this by giving them a target that, again, hopefully only the senescent cells are expressing on their surface. And that's where this urokinase plasminogen activator, or UPAR, comes in. So urokinase plasminogen activator, also called urokinase receptor, has been shown to be expressed preferentially on the surface of senescent cells. It also plays important roles in wound healing and probably other processes. But what the technology is taking advantage of is the fact that it is expressed highly on the surface of senescent cells, and it's elevated in multiple diseases, including cardiopulmonary disease, liver failure, cardiovascular disease, rheumatoid arthritis, and some others. So the idea, and maybe that's because there is a high burden of senescent cells in those contexts, right? So the idea here now is to use the same technology that has been already applied to cancer immunotherapy and apply that to clear senescent cells, specifically senescent cells that have a high level of UPAR. Okay, so let's go back and read this sentence again. We have developed a senolytic therapy based on CAR T cells targeting the senescence-associated protein urokinase plasminogen activator receptor. And we have previously shown these can safely eliminate senescent cells in young animals. And that's the paper from 2003, where what they did was showed, in fact, that they could use this technology, that they could reduce UPAR expressing cells, and they claim reverse senescence-associated pathologies. That's true, but it wasn't in the context of normative aging. It was in the context of specific artificial conditions where you could create large numbers of senescent cells in young mice. Okay, so at that point, the question then remained, okay, so you could do this in young mice where you artificially create a burden of senescent cells. Could you do this in normally aging mice? And if so, what would the benefits be? So that's setting the stage for this new paper, the 2024 paper. Okay, so the next sentence of the abstract is, we now show that UPAR positive senescent cells accumulate during aging, and they can be removed with senolytic CAR T cells, okay? So how did they do this? So they targeted 18 to 20-month-old mice, that's about the equivalent of a 60-year-old person, with this UPAR CAR T therapy. And throughout the entire paper, they had two negative controls. They had age-matched mice that got untreated T cells. So these are T cells that were not engineered to remove senescent cells or remove anything. And then they had T cells that were engineered, but they were engineered to remove a human protein that's not present in mice, okay? So both of those are, again, what we call negative controls. They should not have any beneficial effect. And negative controls are a necessary, critical part for all biomedical research experiments. Because the only way you really can tell if your intervention is having an effect is if you have something to compare it to. And so then they show in the paper that they can reduce UPAR expressing cells and also reduce other senescence markers in mice. And that data seems pretty solid to me. I think the question about safely is a little bit tricky in mice. So I think we can say with confidence they didn't kill the mice, but the analysis of safety in the paper was actually pretty limited. So they showed that they could quote, the mice, quote, remained active without observable signs of morbidity, weight loss, or relevant changes in serum chemistry or complete blood counts. So I would say that's a pretty superficial analysis of adverse events. I'm not really criticizing the authors. I think it's pretty typical. This is more or less what people do in these kinds of studies. But I'd say it's a pretty big leap to say that that demonstrates that there are really no side effects from this kind of a treatment. There were no obvious toxic side effects. I think that's fair to say. But obviously, again, mice in the laboratory are quite different than people living in the real world. So it's a pretty big stretch to conclude that this is a safe therapy at this point. So then I think the next question is really in my mind is, does it really improve health and delay aging? And so the abstract goes on to say, treatment with anti-UPAR CAR T cells increases exercise capacity and physiological aging, and it ameliorated metabolic dysfunction, for example, improving glucose tolerance, in aged mice and in mice on a high-fat diet. Importantly, a single administration of senolytic CAR T cells is sufficient to achieve long-term therapy and preventative effects. So what I want to do sort of for the rest of this episode is really dive into these claims, and let's take a look at whether or not the paper actually demonstrates what the authors are stating here. So I'm going to ignore the high-fat diet part because I don't really think it's that important or informative. I really think the normative aging piece here is where I'm particularly interested, at least. And let's start with the metabolic improvements. So to my eye, these look pretty good. So what they did was looked at the effect of this UPAR senolytic CAR T therapy in aged mice on fasting glucose, glucose tolerance, and insulin response. And it was sort of interesting. So what they showed was that if you compare the two negative controls to the mice that got the therapy, that their fasting glucose actually went down. Now, one thing I will say, and this is true across all of the figures, I think a pretty big limitation of the data presented in this paper is they never actually show the comparison to young mice. So while for some of the things that they measured, there's clearly a statistically significant difference between the mice that got the senescence removing CAR T therapy to the negative controls, but we don't actually know how close to young mice it actually moved the needle. And that to me is kind of a missing piece here. But nonetheless, for fasting glucose, they were able to show that the removal of these senescent cells, or I should maybe more precisely say the UPAR expressing cells, led to a reduction in fasting glucose and what looks like a reduction in area under the curve on a glucose tolerance test. And so the way this glucose tolerance test works is you give mice a known quantity of glucose, and then you measure the glucose levels in circulation over the next couple of hours, right? And this is the same as an oral glucose tolerance test in people. Probably many of you watching have had an oral glucose tolerance test before. So what you can see here is that by following the levels of glucose in the blood over the next couple of hours, the mice that got the CAR T therapy, the senescence removing CAR T therapy in red, that line is below the two negative controls, meaning that their blood glucose levels were lower. Now, again, you have to understand that because the starting glucose levels were different, that the effect here might be somewhat magnified because the area under the curve, of course, is going to measure the area under the curve. But if the starting point of the curve is 10 or 20 units lower, that's going to reduce the area under the curve. So the effect may not be quite as big as it's presented here, but clearly there's a difference. I think we can say that for sure. And this would be consistent with improved glucose homeostasis. They also showed that the insulin response is faster. And I thought this was pretty interesting. So what's shown here is before and after the glucose challenge, the insulin levels measured in blood, again, for the three different groups. So UT is T cells, but not CAR T, programmed T cells. H19 are the cells programmed to recognize a human protein that's not present in mice, and MUPAR are the cells that are programmed to clear the UPAR expressing senescent cells. So if you just compare the UPAR insulin levels at baseline, they're lower than in the other two groups. But the degree to which insulin is stimulated in response to glucose, it comes all the way up. So they interpret this as a better beta cell function that, again, they didn't actually show that, but it's interesting. Again, clearly there's a difference. Clearly there's a more robust insulin response. And I think that's consistent with the idea that there is some improved glucose homeostasis or glucose response in these aged mice. Again, would have been really nice to see what does this look like in young mice so we can really tell, is this actually pushing the UPAR treated mice back to something that looks functionally more like a young mouse. So they claimed that this also reflected improved insulin sensitivity. And this is where I got a little bit confused. So this was sort of buried in supplemental data. And again, for those of you who don't read scientific papers all the time, oftentimes people will put things in supplemental data for good reasons. Sometimes they'll put things in supplemental data because the data aren't quite as clean as you might hope. And so sometimes I wonder when I see something that seems like it would be important in supplemental data, does that mean that maybe it wasn't quite as convincing as you might anticipate? So anyways, had to go look at extended figure 7 and see exactly what's shown here about the insulin sensitivity. So again, the idea here is that when you take in a large amount of glucose, your body will secrete insulin in response to that. And then the insulin signals your cells to take that glucose out of circulation. And so insulin sensitivity is sort of a measure of how much insulin does your body have to make in order to clear a specific amount of glucose. That's where the sensitivity part comes in. And so for this experiment, what they did was give an insulin infusion and follow glucose levels over time. And that's what's shown here in this figure, where at time 0 is when the insulin infusion was given. And this is comparing only the mice that got T cells that were not programmed with any CAR T to the UPAR T cells, so the senescence clearing T cells, blue and red. And you can see the red curve, the UPAR treated mice are always lower than the negative control, which is sort of interesting because even at baseline, they're lower. But if you take out that baseline effect, there really doesn't seem to be any difference, to my eye at least, between the two curves. So is this really an effect of insulin sensitivity, or is this an effect of just the fact that the UPAR-treated mice have lower glucose levels to begin with? I at least couldn't disentangle that. So I'm not convinced there's any real change in insulin sensitivity here. Okay, so anyways, altogether, I'd say it's sort of modestly convincing, consistent with the idea that clearing these UPAR senescent cells improves metabolic function, or at least some aspects of metabolic function in the aged animals. But it's a little bit difficult for me to evaluate how effective the therapy is at restoring function without knowing what youthful function would look like in this context. Okay, so now let's look at the exercise capacity. And I got to say, for the amount of attention that this was given in the abstract and in the article, I was a little surprised to find this was only mentioned once in the article. And the specific sentence in the entire article is, in addition, most aged mice with the UPAR treatment showed improvements in their exercise capacity at 2.5 months after treatment compared to pretreatment levels. And that was data was shown in figures 5E and F. So let's take a look at figure 5E and F and see what this actually shows. So there's really two pieces of data shown here. Both of these are based on a treadmill test. And essentially, you can just think of it as mice are put on a treadmill. The treadmill's moving very slowly at first, and then gradually the speed increases at set increments, right? And what you're looking for is how fast can the mice get up to? So what speed can they get up to? And how long were they able to keep running? So that's the running duration, is how long were they able to keep running? And the maximum speed is what speed could the treadmill get up to before the mice basically gave up and fall off the treadmill. Okay, and again, three groups, two are negative controls. The red is the UPAR CAR-T treated mice. And so in both cases, the way the data is represented is as a fold change compared to pretreatment. Okay, so it's within each group, they are comparing the post-treatment animals to pre-treatment animals. And this makes it a little bit hard to actually evaluate exactly what's going on, because we don't know if there were differences between the group pre-treatment, because that sort of is hidden in the fold change. And again, unfortunately, I wasn't able to find that data in the paper and the supplementary materials, so maybe I missed it. The other thing, again, of course, that's missing is what would this look like in a young mouse? Because really, in order to evaluate how well did the treatment reverse things back to functionally what we would expect to see in a young animal, we would need to be able to have that information. Again, that wasn't provided. So I think what we can say is for the running duration, it does seem to be the case that there is a statistically significant increase in the mice that got the CAR-T therapy to remove the UPAR senescent cells. And that's statistically significant relative to both of the negative controls. And looking at the sort of scatter, so each of those dots in the figure there represent different animals. So again, this is just sort of a useful thing to be aware of when you're looking at data like this. You get two pieces of information from this. One is, does it look like all of the animals showed an improvement or just a subset of animals? And secondly, you can get a feel for how big was the population that they used for the experiments. So in this case, it looks like 6 to 8 mice per group. That's not huge. It's also not, so small that it raises huge red flags, but it's not a really large study by mouse experimental standards. So it's just worth having that sort of information when you look at the data. Nonetheless, looks like a statistically significant effect here. Looks like it's probably real. And it's a little bit hard to tell if this is an improvement in all of the animals or just some of the animals. So that's for running duration. When you look at maximum speed, I would say it's much less convincing that there's anything real here. And in fact, if you look at the scatter of the points, there appears to be one animal in the UPAR treated group where there was a big increase in maximum speed achieved, and the rest of the animals are more or less overlapping with the two negative controls. In this case as well, only the comparison was only statistically significant to one of the two negative controls. So in my mind, That's pretty weak sauce to make a comparison that there's any change relative to the negative controls. Certainly not something that I would want to hang my hat on. So again, I don't know. I feel like this is not as convincing as it's made out to be in the abstract or the accompanying article from the BBC. So, maybe there's a real effect here. I'd really want to see more assessments of muscle function to really understand, what's going on and how convincing is this. So then what about other effects on aging, right? Again, there are lots of things you could look at for health span and, of course, lifespan as well. So as I mentioned earlier, senolytic treatments have been shown to have positive effects on lifespan and improvements in many, many tissues and organs. You kind of have to wonder, why did they pick exercise capacity and metabolic function, and specifically really only oral glucose response and insulin for the things that were assessed to look at physiological readouts of aging? I don't know the answer to that, but it's something I wonder about. And then what about lifespan? And that's what I found sort of particularly disappointing was if we look at the section where they're trying to demonstrate persistence of effects from the treatment, it reads, despite the initially lower numbers of UPAR positive cells compared to aged animals, see above, UPAR CAR T cells were detectable in the spleens and livers of treated mice 12 months after the initial single infusion at substantially higher levels than the low number of persisting UT or H19 CAR T controls, consistent with their persistent activity. So I read this and I thought that was good. I mean, it certainly demonstrates that there is persistent immunological response to the therapy and to the UPAR expressing senescent cells. But it also, in my mind, made me think, so if the initial treatment was done at 20 months of age, and they looked in the spleens of mice 12 months after that treatment, those mice were 30 to 32 months old at the time that they looked in those spleens. And so that's well past the median lifespan for C57 Black 6N mice, which is about 28 months. So it seems to me that if the cohort was aged out to 30 or 32 months, they must know whether or not the treatment is having any large effect on lifespan. And that information wasn't included in the study. So again, I admit I'm naturally skeptical, maybe a little bit too suspicious, but it does make me wonder when people don't present data, if there's a reason why the data wasn't presented. So I really would like to know, does this therapy significantly increase lifespan or not? And presumably, if there was at least a large effect on lifespan, that would have been apparent by 30 to 32 months of age. So maybe that's coming in a future study. Maybe a larger lifespan experiment is ongoing. Maybe the cohort size wasn't big enough that the authors felt comfortable or confident presenting that data. I don't know the answer to that, but it does make me wonder if this therapy did not, in fact, have any effect on lifespan, and that's why it wasn't included. So we aren't going to know the answer for a while, probably, but I do feel like this was a pretty big weakness in this paper. If you really want to convince me that a therapy is having a significant impact on the biological aging process, I really look for two things. I look for significant impact on lifespan and significant impact on multiple age-related health span metrics. And I kind of feel like we didn't really get, certainly not the lifespan data, and the health span data here was pretty limited. So I'd say the take-homes are certainly that the UPAR senescent cells accumulate during aging, and they can be targeted with CAR T therapy, and it appears safe, at least at the level of overt toxicity in mice. That I think is pretty well demonstrated in this paper. That had been previously shown for young animals, and this is a significant advance, showing that you can do that in aged animals. Again, safe in laboratory mice obviously doesn't mean safe in people. And again, at least at this initial report, the benefits seem pretty small compared to other senolytic studies and certainly compared to more effective interventions like caloric restriction or rapamycin. Okay, so now let's look at the BBC article, and I'm just going to read it and sort of give my reactions as I'm reading through the article. So the text of the article starts with, the fountain of youth is not locked away in a sorcerer's stone or mythical water feature, according to a new study. So I kind of like that first sentence. In fact, scientists in the USA say the key to slowing aging is hidden inside our bodies. Okay, again, obviously, this is a little bit of trying to set the stage. I would say that's kind of overstated. This may be a bit pedantic, but it is worth noting the CAR T cells that recognize the UPAR expressing senescent cells are not, in fact, within our bodies. Those have to be engineered and then put in the bodies of the mice. So it does kind of mislead into the idea that this is something that already exists in our bodies, when in fact this is a exogenously introduced therapy, really in many ways no different than a drug that you would exogenously introduce in that way. Okay, published in Nature Aging, the new research reveals the trick to anti-aging lies within the white blood cells known as T cells. Again, you have to engineer them, but okay. The researchers behind the study discovered that they can reprogram these cells to turn them into aging cell killing machines known as CAR, chimeric antigen receptor T cells. Right. When they tested the treatment in mice, the mice went on to live healthier lives. Did they really show that? With lower body weights, improved metabolism and glucose tolerance, okay, and increased physical activity. So we went through the data. You can assess for yourself whether you believe that they really showed that there's increased physical activity. And all that without any tissue damage or toxicity. Again, as I mentioned, that really was not looked at in any comprehensive way. If we give it to aged mice, and this is a quote from one of the study authors, if we give it to aged mice, they rejuvenate. If we give it to young mice, they age slower. No other therapy right now can do this, said Corina Amor Vegas, assistant professor at the Cold Spring Harbor Laboratory in the USA and one of the authors of the paper. And I feel a little bad. I'm really not trying to call out Dr. Vegas here, but this does bother me a little bit. So it is, I would say, absolutely wrong to say that no other therapy right now can rejuvenate mice, certainly to the extent that was shown here, or cause mice to age slower. As I've sort of mentioned a couple of times, there are many therapies that have been reported to have effects greater than what is shown in this paper. And in particular, other senolytics have been shown to have more comprehensive effects, at least than what was demonstrated in this paper. And certainly rapamycin and caloric restriction not only have far more comprehensive health span effects than what was shown in this paper, but much, much larger lifespan effects, considering that no lifespan effect was shown in this paper. So I think that was a pretty blatant overstatement. And again, I will give Dr. Vegas the benefit of the doubt. I'm guessing she was misquoted here, but certainly I don't agree with that interpretation of how this work fits into the broader state of the field. Okay, so we'll go on with the BBC article. The researchers are calling this treatment the living drug. I kind of like that. That's cool. That's because when genetically modified, the CAR T cells actively attack a group of cells known as senescent cells, right? Senescent cells are responsible for many of the conditions and diseases we get as we grow old, such as obesity and diabetes. Again, that's probably a bit of an overstatement. Are they responsible for those diseases? Do they contribute? Sure, in some people. Certainly, I wouldn't say they're responsible for those diseases. We accumulate more and more of them as the years go by, but this builds up harmful inflammation. I would agree with that. The CAR T cells, however, could remove them and therefore slow the impacts of aging. Again, conceptually, I would agree with that. I would say this paper doesn't actually demonstrate that to a broad extent. It's pretty limited in the impacts on aging that we're showing here. The treatment has already been approved in the USA to tackle blood cancer. So this is a little bit of, I think, unfortunate wording. So CAR T cell therapy, yes, has been approved for certain types of cancer use. CAR T cell therapy targeted towards senescent cells has not been approved. I don't think there have ever even been any phase 1 safety studies in humans. So this is a little bit misleading the way it's phrased, but I just think that's unfortunate phrasing. However, this is the first time scientists have shown CAR T cells can also slow and even reduce the effects of aging. And again, as I've sort of mentioned, I don't think this paper actually shows that too convincingly. While there are already drugs that can eliminate senescent cells, those are the senolytics, these have to be taken repeatedly. That's kind of true. They probably have to be taken repeatedly to get the largest effects. There's some data, though, that even single treatments with senolytics can have beneficial effects. And there's data with rapamycin that we published in my lab back in 2016 that a single 3-month treatment with rapamycin from 20 to 23 months of age has very large prolonged effects on lifespan and, again, at least a couple of health span metrics. So it's not the case that you necessarily have to do repeated treatments in mice, but certainly I would agree that repeated treatments are probably needed to optimize the benefits of senolytics in mice and presumably in humans if senolytics have significant effects in humans. Okay, the effects of CAR T cells, on the other hand, are long-lasting. One dose at a young age protects you for life. Again, that's conceptually, I think, true. There is really nothing, as far as I'm aware, in this paper that showed that a single dose given to young animals had lifelong benefits that led to health span benefits in old animals. So I don't think that's actually been shown, but again, maybe I missed that in the paper. This is another quote from Dr. Amor-Vegas. With CAR T cells, you have the potential of getting this one treatment and then that's it, said Amor-Vegas. For chronic pathologies, that's a huge advantage. Think about patients who need treatment multiple times per day versus you get an infusion and then you're good to go for multiple years. And I would agree with that. It's an advantage. It's potentially also a disadvantage, and I'll come back to that in a minute. And then the article ends, next, the scientists will investigate whether the cells not only make the rest of your life healthier, but also whether they could help you live longer. Okay, so that's the BBC article, and as you can see, I have several sort of minor to moderate clarifications that I would add to that article. Okay, so what grade do we give the BBC article? And so this is the start of the term, so maybe I'm being a little harsh here, but I would give that article a D. And again, maybe my grading scale will relax as we go on. But, so as I sort of alluded to, I think there are several places here where the BBC article pretty dramatically overstates what the scientific article showed and the state of that science as it exists today, the limitations to, where we're at today compared to what the BBC article said. So I want to just now take a minute to talk a little bit more generally about this idea of immune-based therapies to target aging. So I really think this is super intriguing. I think it's one that's worth further study. I know I've been a little bit critical maybe of the way that some of the data in this paper was presented. I want to also say I've got a huge amount of respect for the scientists doing this work. I think that this area of tackling the immune system to target aging is super innovative. So I'm not at all critical of the approach or even the data. I think the experiments were well done. I just think it's a little bit overstated for what's actually been shown so far. I do also think that senescent cells are the most obvious use case for these sort of immune-based therapeutic approaches to targeting aging, but the impact there really remains unclear. And, honestly, so far, the senescent cell clearing methods, senolytics in general, I think most people would agree, really haven't lived up to the expectations that we had in terms of health span or lifespan in the animal studies. So to summarize, I'd say this study builds on prior work by the same group, where they'd previously shown that they could engineer CAR T cells to kill one class of senescent cells, more specifically cells expressing high levels of urokinase plasminogen activator on the cell surface. And their prior study did this in young animals, and honestly, it was really more of a proof of principle approach. And what this new study shows is it extends that approach to aged animals, which is necessary and important. And they provided evidence for lower blood glucose in those animals, for improved oral glucose tolerance response and better insulin response, and a little bit of evidence for increased exercise tolerance. But again, I think that was pretty weak in the sort of, bigger picture of, does that really mean that these mice have better muscle function, better physiological function? But I think this is an important next step in demonstrating that the same therapy can in fact be applied in aged animals. And I'm hopeful that in the next paper, we'll see maybe more convincing evidence for broader impacts on the biology of aging. So in summary, they did not show increased lifespan, improved health span. There are many available metrics that could have been tested that weren't. And in particular, I think about frailty, cancer incidence, cognitive function, immune function, oral health, lots and lots of things that can be looked at in mice that I think would make a more convincing case that this is having a broader effect on biological aging. And then finally, I think more broadly, when we think about translation of this to humans, even if this is eventually proven to have large effects on mice, my feeling is we're still pretty far away from seeing this in humans for aging or longevity. And the reason I say that is I think that the risk of unforeseen side effects here, for example, what if UPAR is needed for something important in the elderly, is going to make it difficult for regulatory agencies to approve this kind of a therapy without pretty significant safety studies. So again, we don't really know all of the things that urokinase plasminogen activator might be useful for or important for. And if we're removing cells sort of generally that are expressing high levels of this, most of those cells might be senescent cells. But what if a subset of them are important for wound healing? And we get rid of those in older people and they start having problems because they get a wound or they fall and get a bruise and they need to have this protein or the cells that are expressing high levels of this protein. So I think there are going to be some concerns about the risk here. And the other piece that I would point to is, the authors kind of make a big deal of the idea that you only have to take it once, which is nice from a therapeutic perspective. The downside of these kinds of therapies that rely on the immune system or on gene therapy are that it's really hard to reverse. So if there are unwanted side effects with a small molecule, you can usually stop taking the drug. If you've kind of permanently modified the genome or the immune system, it's really hard to turn that off. And so again, my feeling is that, regulators are going to want to see pretty clear evidence that there is a very, very low risk to these kinds of approaches. And so I feel like it's going to take a while to move these through the regulatory process and the clinical trial process. So my feeling is, in addition to the challenges of developing therapies to target aging, these sorts of classes of treatments have additional burden that they're going to run into as they go through the regulatory process. But I do think that we will start to see these kinds of therapies for more serious diseases where senescent cells in particular are major players. So for example, things like idiopathic pulmonary fibrosis, where there's already pretty good evidence that some small molecule senolytics can have benefits, at least in animal models and a little bit in humans. And so maybe this type of an immune-based therapy will be able to be shown to have a large degree of efficacy, better than the small molecules. And you're willing to tolerate a little bit higher risk based on the benefit that those patients are going to see because they have a very serious condition. So that's kind of my speculation on how this will play out. So the other place where I think these sort of immune-based therapies have a pretty big advantage is that it's much easier to target cells that you want to clear sort of on demand, right? So if you have a small molecule, even if you can identify, say, a protein that you think if we can inhibit this protein, it will kill this class of senescent cells, finding a small molecule that's a potent inhibitor of a specific protein is non-trivial. With the sort of immune-based therapies, it's much easier if you know that there is a specific protein. So in this case, we've talked a lot about UPAR. It doesn't have to be UPAR, it could be a different protein that is preferentially expressed at a high level on the surface of a specific subset of senescent cells. You can engineer pretty easily a specific CAR T therapy to go kill only those cells. And so in that way, these immune-based technologies are much more easier to deploy in a targeted way. I really think that's their bigger advantage, more so than the idea that you only have to give it once. I think it's the flexibility they give to target specific cell types on demand based on markers that they express preferentially on their surface. And so I think that's where we'll see a lot of rapid advancement going forward. And this isn't necessarily restricted to senescent cells, right? We talked obviously about how this was first developed for cancer cells. Maybe there are other types of bad actors in the context of aging that you would want to go after with these kinds of therapies as well. So anyways, in my view, it's still pretty early days for these potential immune therapies as a use case to target aging, but I'd say it's one of several very promising strategies, but probably still several years off from seeing human application, even for significant disease, let alone for more generally targeting aging or trying to improve health span. Okay, so I hope you enjoyed this episode and you found it informative. If you're not already a subscriber to the channel, please consider subscribing to the OptiSpan podcast. And as always, please feel free to leave questions or comments below. Coming up on longevity this week soon, I'll discuss a couple of more recent papers, one on the fasting mimicking diet, one on partial epigenetic reprogramming. So hopefully you will tune in for that. And I hope to see you next time on the OptiSpan podcast.